India entered the pandemic with a vaccine advantage, with the capacity to produce 1.5 billion to 2 billion doses a year, and also has decades of experience in large-scale immunization. But, why did the COVID-19 situation in India go from under control to disaster? Why couldn't these advantages help India escape the worst of the pandemic? What went wrong? In the early stages of the outbreak, India crashed COVID-19 by testing, contact tracing, isolating and treating the infected people, but after that, Government of India didn't take it seriously. By the end of 2020, Indian government let down their guard. Modi and his party focused on the Indian election. Even as significant pockets of the country had not fully suppressed the virus, Modi and his party held jam-packed outdoor campaign rallies before the April elections. COVID safety protocols were not being followed, no social distancing. Few attendees wore masks but didn't wear properly. Besides that, Modi also allowed religious festivals such as Kumbh Mela, the world's largest gathering of humanity, to proceed. A responsible government knows that large gatherings should not be held during the epidemic, but Modi just let that happen. The ironic thing is that in January Modi declared at a global forum that India had saved humanity by containing corona effectively. In March, his health minister proclaimed that the pandemic was reaching an endgame. Modi even professed that India will win the corona war in 21 days. He even said India's battle against coronavirus is inspiring the world. Of course, India inspires the world, for not repeating the same mistake. In order to compete with China, India engaged in vaccine diplomacy too, and even proclaimed that people in other countries felt that Indians' vaccines were better than China. According to government data, India has shipped 66 million doses overseas since January 2021. India launched the country's vaccination program in January. Modi lauded the country's ability to produce its own vaccines and help other countries. However, just around 1.9% of India's 1.39 billion people had been fully vaccinated against COVID-19 by early May due to shortage of vaccine supplies. India, now the new epicenter of the global pandemic, touching 400,000 new cases per day in May. However, this statistic fails to capture the sheer horror unfolding there. COVID-19 patients are dying in hospitals because doctors have no oxygen to give and no life-saving drugs to offer. Healthcare systems in many Indian cities are overwhelmed. Why does this happen? Can you imagine? India currently spends about 1% of GDP on health, among the lowest for any major economy. All these because of Modi and his government downplaying the pandemic's severity, disregarding science, made no preparations for possible contingencies such as the emergence of a deadlier and more contagious COVID-19. Therefore, the control of the epidemic cannot be entrusted to a politician who treats himself as a god. The professional matters must be entrusted to the professionals. India, like purgatory now, non-stop cremation day and night. Bodies of COVID-19 victims have been found dumped in some Indian rivers. India's holiest river, the Ganges, has been swollen with bodies. Thousands of black fungus cases reported across India worsen the situation. Mucormycosis, or black fungus, usually infects people whose immune system has been compromised, causing blackening or discoloration over the nose, blurred or double vision, chest pain, breathing difficulties, and coughing blood. Imagine someone survived the COVID-19 but died due to black fungus. The coronavirus pandemic is really a magic mirror. The country has reached such a terrible juncture, yet politicians are still calculating their own interests. Besides blaming the opposition party, Modi was busy in deleting the voices against him on Twitter. Many countries know that this second COVID wave in India is very serious, thus many of the democratic countries that are in close ties with India have responded correctly. To evacuate their citizens and permanent residents, and to execute a travel ban restricted flight to and from India. If India continues to let COVID-19 out of control without imposing major restrictions to stop the spread of virus, politicians continue to fight the virus by lip service, and the people continue to let the guard down, then it will be useless no matter how well other countries did. If a country does not even have the ability to let its people breathe, if a country finds a problem, doesn't solve it actively but divert its attention, how can such a country become a superpower? Friends in India, you cannot just see how bad your opponents are, you should also learn the good merits of your opponents. India and China have a demographic advantage. But why can China build a hospital in 10 days, but you cannot? The virus doesn't respect borders, or nationalities, or age, or sex or religion, everyone is equal, whether you are a superior leader or a civilian, and the virus liked those who looked down on them most. Therefore, my friends in India, blindly accusing others cannot solve your problem, it also cannot make your country become stronger. Now we sincerely hope that the Modi government will turn around and strictly control the epidemic. The government in the future could increase spending on infrastructure, medical facilities, and improve India's healthcare system. Friends from India, I hope your country will get better and better. Let us know in the comment down below if you have any different opinions. Thank you so much for watching. If you like our videos, please subscribe to our channel and share them with people you know. See you in our next video. Bye.